In 2000, we already observed globally around 140,000 deaths because of climate change. And the Intergovernmental Panel of Climate Change in 2007 said that millions of people will be affected to either die or be affected or become sick because of climate change. Now, climate change affects health directly and indirectly. Now, directly, just to mention a few, would be through an increase in the frequency and the intensity of extreme events. And an example is the typhoon of a few days ago, but also to mention some events which happened in our European region. The 70,000 deaths are attributable to the heat wave in 2003 in 12 European countries, or the tens of thousands of deaths which occurred in the fire and heat wave event just in 2010 in the Russian Federation. These are just a few of the, let's call it, icebergs, the tops of the icebergs we are observing. However, there are much more creeping events, if I can call them like this, occurring, such as, for example, changes in the distribution of infectious diseases. I mean, this few years ago and this year we had a few outbreaks of dengue. Dengue hadn't been in the European region for many decades. It just occurred occasionally when a tourist was coming back, but we didn't have indigenous cases, as we call them, or West Nile fever or Rift Valley. These are all occurrences which are somehow peaking up, having a small outbreak. Normally they are limited, and if we take proper public health action. But there are also other examples. I mean, for example, we have the Russian North, we have the subarctic areas, permafrost melting. We have observed actually that the reindeers, herders, which normally were able to at least 6 months stay with their families, are now only able to come back for 2.5 months and then have proper health care, and particularly their children. Or there are examples from Central Asia where you have both phenomena. You have on the one hand the high mountains in the Tajikistan and Kyrgyzstan, for example, with big events and still occurring a number of infectious diseases. But you also have the big plains, drought areas with high levels of water and foodborne diseases. And if we assume that it's becoming drier in those areas, I mean, some thousands, if not hundreds of thousands of people will be needing to migrate further to the east, the west, wherever it is possible. But this is just to mention a few of our European examples we are already observing. So that's not something which is predicted to happen, that's what we observed. So in terms of anticipated events, I mean, there are some anticipations which go to scenarios of 2050, 2070, with doubling the amount of heat-related mortality. There are anticipations of, in particular, vectors moving further north or higher up into the mountains, etc., etc. But what I think is the key message here, we are already observing effects. And the second message is we absolutely need to adapt now.
Yeah, absolutely. I mean, I guess there are more and more people on the planet every year, so they're likely to be more deaths. I mean, to what extent are a lot of these issues related to countries not investing in proper infrastructure and countries not, looking after their domestic populations? I'm just trying to work out the direct links between health and climate impacts.
That's an excellent question, and we have a few of African delegates here in the delegations at this conference, and it was very interesting. One of our African colleagues actually made this point, that where you have actually a lack of public health infrastructure, where the current health services and systems are absolutely not able to cope with the current problems, malaria, huge amounts of mortality from malnutrition, etc., etc. So even a little bit of increase of temperature or a little extreme event is actually not only having one effect, but it has a cascade of effects. So you can imagine that one of the basic messages is actually to create basic infrastructure.
And in terms of future projections and future impacts, what is the WHO doing? What can you realistically do? What work are you doing with different countries?
Now I'm speaking about two levels. I mean, the first one is we do have the World Health Assembly. The World Health Assembly in 2008 did a World Health Assembly resolution, which means all 193 ministers of health agreed to enhance action on, in particular, adaptation to climate change, and called upon the WHO to develop a work plan. So we developed a 5-year work plan, which is particularly looking at cooperation with the different institutions, particularly the United Framework Convention of Climate Change, scaling up research initiatives, but also scaling up health systems development, so assistance to our member states. That's number one. The number two is that has been followed up or even earlier developed at the regional level with the so-called regional either frameworks for action or the regional committee decisions, both by the Ministers of Health and by the Ministers of Environment. So we have action plans on what is to be done, and they are quite concrete. Give you an example. For example, in the European region, it includes also mitigation. I mean, we are very much working on the co-benefits of mitigation for population health now and locally. And this includes, for example, the promotion of cycling and walking. I mean, 30 minutes of walking a day can save you 3.5 months of life expectancy. This is the type of numbers, or it can reduce or halve actually the amount of deaths, just simply to mention one number in the European Union, which is annually 350,000 deaths from particulate matter, but stringent action on air quality guidelines increasing could be halving the amount of deaths expected in the European Union. So this is the type of efforts where some very concrete actions have been nominated and actually are implemented by our member states. So that's, and we do assist them. We provide tools, methods, we develop capacity. And one of the nice examples now, which is new from the African region and from our main office in headquarters, we're trying to bring negotiators within to this negotiation so that actually at this conference and in the future negotiations, health is given a proper place.